Their location, 5030 South Pine Avenue in Ocala, just past the drive-in. And of course, don't forget to visit them on the web, CaptainTUpholstery.com.
The very best in quality is Captain T's Upholstery.
Here's what you may have missed on the John Tesh Radio Show.
We could all take a page out of the toddler book. Whether you deserve a raise or the restaurant server brings you the wrong entree, go ahead and speak up. Hang out with happy people more often. Positive emotions tend to be contagious. People who took aspirin regularly for at least 6 years ended up being 11% less likely on average to die of cancer.
Intelligence for your life on the John Tesh Radio Show. Don't miss this stuff.
All right, well, that wasn't planned. 9 minutes before 10 o'clock, and it is a nice-looking day out there. 75 degrees, temperatures climbing to 82, so kind of mild today. And we have on the phone Dr. Michael Harrison, and the comment that John Tesh just made in that recording, I'm going to ask him about, talking about cancer and the effects of aspirin is what he suggested. Dr. Harrison will answer that question, but Dr. Harrison specializes in treating people with genitourinary cancers such as bladder, prostate, testicular, and kidney cancers, and I probably mispronounced one of those words at least. Cancer immunotherapy for bladder cancer is the specific topic. Dr. Michael Harrison, what an honor to have you on our show. Good morning, sir.
Good morning. Thanks so much for having me.
You're welcome. Where are you? Where are you calling from?
So I am in Durham, North Carolina at the Duke Cancer Institute.
All right. I guess we'll start with this because John Tesh kind of said something about aspirin and cancer. Is that true? That if you take an aspirin, you're less likely to get cancer?
So that's broadly true against, for some cancers. It's not been proven in the cancers I treat, so like bladder cancer.
Oh, okay.
But there are certainly a lot of reasons to take a low-dose aspirin.
Oh, okay.
So I would encourage people to ask their doctor about that.
All right. So tell me about the type of cancers you specifically work with. It sounds like it's both genders, am I right? Except for the testicular one and the prostate one.
That's right. Yeah, well, and then also bladder and kidney cancer tend to be male predominant. So,
oh, really?
So my clinic is probably 3/4 men or more.
I wonder why. Is there a reason why?
Well, for bladder cancer, it's not really that well known. Bladder cancer has been linked to smoking, and so for a long time, men had a higher incidence of smoking, although women have since caught up. Bladder cancer is also linked to exposures to industrial chemicals, including dyes. So sometimes men are more likely to have occupations like that. So not totally understood, but those are some of the potential reasons.
So is it like other cancers when we hear about the early diagnosis is the best way to prevent dying from a cancer?
Yes, that's correct. So bladder cancer, when it's diagnosed early, can be cured. And so, people commonly do have symptoms, fortunately, of bladder cancer when it is early along. And so these can include things like blood in the urine or other urinary symptoms that can lead them to present to medical care.
So will this cancer be able to be contained in the bladder if it's caught in the early stages instead of it moving?
So typically, yes. So if it's caught in the early stages when it's confined to the bladder, it can be treated and cured in many cases.
What do you say to somebody who's been just diagnosed? I'm sure that they are filled with fear and concern. What is the news for that person?
Yes, and I think the first thing to recognize is it's very common to be afraid and to be concerned. I think what I would tell people and what I tell my family and friends is that they need to seek help from a specialist, and that's an oncologist. So have a consultation with someone who specializes in treating cancer to determine the right treatments for them and see if there are treatments such as immunotherapy or other options that may be appropriate.
And you've been doing it long enough that you probably have seen changes in how it's treated. Are the new changes giving you any hope for maybe what we'll see in the future?
Yes, so for bladder cancer, there is a lot of hope. So for the past about 30 years, there had been no advances. There had been no FDA approvals for advanced bladder cancer specifically. But in the last year, we've had 5 new approvals. So this is giving me and my patients a lot of hope.
And the things that have been approved, have you used them and have you seen the results? Is it looking good?
Yes, so I have experience in the clinical trials of these drugs, and these are immunotherapies, and they have had really good results. So they are approved in two different settings, basically. So when bladder cancer is advanced, it means it's spread outside the bladder, or it's so-called stage 4 or metastatic. And in that setting, the standard of care had been chemotherapy. So chemotherapy, such as cisplatin chemotherapy, though, was not appropriate for about half of people. They just weren't eligible for it. And this is where immunotherapy, such as atezolizumab, was approved 1 month ago. And so this is giving, that half of people that didn't really have great options, this is giving them a new option and therefore new hope.
So each drug that's approved, it's for a specific type of cancer. You can't move it around from one cancer to the other.
Yes, and that's a good point. And so these approvals and drug development has gotten very complicated, where drugs are approved for a specific cancer and then for a specific indication in that cancer. So such as, sometimes you have to have had this drug but not that drug, and so on and so forth. So I think that's where it's vital to see someone who specializes in cancer to help determine what treatment options are right for the specific patient in question.
So when a new drug is approved by the FDA, I'm guessing that announcement makes its way to all of the cancer specialists in the country. Is the radio interview to inform the listener or the medical society, or both?
Well, I think it's a little bit of both, and this is a good point. So, again, with so many approvals in the past year and so much change, certainly the oncologists are struggling to keep up, and that's not just specific to bladder cancer. That's across all cancers. Yeah. Things are changing, and this is a good problem to have, by the way, but changing so rapidly for the better that sometimes, oncologists are just doing their best to keep up, and they may not know what the new treatments are. So this is where a referral to an academic center such as Duke or others could be of assistance. We can, and I commonly do this, give patients reassurance that they're on the right track, or it might be telling them, well, what about this new option? It might be telling them about clinical trials. So I think, with the pace of change, that's where, we at the academic centers can really be of assistance, both to oncologists but also to patients, of course.
And will these treatments also affect the good cells too? They hurt them?
So that's a good question, and that's a great question, because I think it's commonly known that chemotherapy, while it can kill the cancer, it can affect the normal cells, and that's where the side effects arise. In terms of immunotherapy, it's similar. When we see side effects, it's from the immune system getting too revved up, so to speak, and starting to attack the normal tissue. And so that can cause inflammation anywhere in the body, but common areas would be, lung problems, liver problems, intestinal problems, or hormonal gland problems. Fortunately, though, the rate of those side effects is not that high, and it's not that common that they're really severe.
Dr. Michael Harrison is our guest. We've got less than a minute, Doctor. I want to make sure the listeners can look this up in more detail, maybe a website. Does Duke Cancer Center have a website, and any other research information you can give for our listeners?
Sure, yeah. So if you go to if you just Google Duke Cancer Institute, it will bring you to our website. But some other great resources are the Bladder Cancer Advocacy Network website, which is www.bcan.org, or the American Cancer Society website, which is www.cancer.org. Both of those websites have great information on bladder cancer, about the treatments, including immunotherapy, and also about clinical trials.
All right. Doctor, thank you for being on the air with us today. We will share this as a podcast so that other people can benefit from it as well. Thank you, Doctor. We will be right back.
96.3 FM, The Source.
Fox News Radio, I'm Karen McHugh. Montana GOP congressional hopeful Greg Gianforte charged with misdemeanor assault after body slamming reporter Ben Jacobs from The Guardian last night. The incident witnessed by a Fox reporter.
I myself was standing about